Hello, everyone. Thank you for choosing to participate in this workshop this week and for listening to this presentation on choosing mental health and faith. My name is Gloria Cisse. I am a licensed professional counselor and a licensed master social worker here in Macon, Georgia. And I've been practicing for a few years, but I really have had an opportunity lately to talk more and more about how we can help people to understand the importance of including mental health in our lives, especially if we are people who are faithful. I believe that these two things can coexist, and more in my community, I'm seeing that these things are coexisting. So, what I'm going to cover in this conversation, this brief conversation with you today, I'm going to explain relaxation techniques, and we're going to actually do at least one relaxation technique. I'm going to talk about. I'm going to give a definition of faith and the definition of mental health and mental illness, and then I'm going to try to combine these things so that we understand and we walk away with a clear idea of the importance of faith, mental health, and mental illness. And then I'm going to talk a little bit about the hesitations that people in marginalized communities, particularly the BIPOC community, have around participating in mental health treatment because of the mistrust, the histories, and the lack of exposure. And then I'm going to give everyone a brief explanation of choice theory and how you can use choice theory in your everyday life. It's a mental health, a set of techniques that I use on a regular basis. And so I like to encourage people to do that. And then I'm going to talk a little bit about Taranga. So, which is a concept that I learned when I traveled to West Africa the first time, and so I will talk about that. So let's practice what we call a grounding technique, which I believe is a great way to always start if we has some kind of exposure to a trauma or we are struggling in our day. I think that it's really important that we ground ourselves first. And a very familiar grounding technique is one that's called the 5-4-3-2-1. And in this technique, what we do is first we take a deep breath. And so just kind of go along with me here. And I want you to inhale through your nose and then try to feel it in your belly. All right. So you're going to inhale, and I'm going to count to 4. And then you're going to exhale, and you're going to blow it out. All right. And I'm going to count to 6. I'm going to do that 3 times. I'm going to do it 3 times, and then we're going to do the box breathing. Excuse me, we're not going to do the box breathing. We're going to do the grounding technique, the 5-4-3-2-1. So inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4, 5, 6. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4, 5, 6. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4, 5, 6. Now what I'd like for you to do is breathe normally and look around the environment where you are and identify 5 things that you can see. Just kind of catalog those in your memory. 5 things that you see, and then 4 things that you can touch. 3 things that you hear. 2 things that you can smell. And 1 thing that you can taste. Now, when you are practicing this activity in real life, you're going to do the breathing first and you're going to do some breathing afterwards. But hopefully what it does, the desired effect, is to have you to become very present in the moment, right? Very present in what's happening in your life in the moment, which then can help you to kind of regroup and move on to the next thing that you have to do. All right, so we're gonna relax. We got one relaxation technique in our suitcase, right? In our that goes in our on our tool belt. All right, so I want to remind us here that the World Health Organization tells us that there is no health without mental health. So we think, we kind of move around, move through life, and most of the time we're kind of cruising through neutral, right? There's not a whole lot of stuff going on. But when we become extremely stressed out, things are like what we like to say, life happens, then it kind of gets us off balance. But the way that we can get back on balance is if we have some good techniques and tools. They call it resilience, and being able to bounce back from something that might upset you in the moment. So it's really important, because if we fall down and we can't get back up, then it's less likely that we're going to be successful in the things that we want to do in our everyday life, right? And I also would like for us to think about the idea that we can see things that hurt us physically, right? We can see a cut, we can see a stab wound, we can see a gunshot wound, right? We can see a broken bone, but it is not possible to see the fractures, the wounds that we have in our minds. So when we are thinking about this idea of faith and we're thinking about mental health, I'm trying to kind of combine these two ideas for us, then we have to remember that faith is the assurance of things hoped for and the conviction of things that we don't see. And so we want to, and hopefully we're all like striving for being a more mentally healthy life. And we can't necessarily see that, but I'm going to tell you a little bit about how you can start to see it. But we want it nonetheless. We want to be more mentally healthy. We want to be as mentally healthy as we can be. But then, okay, so a definition of mental health itself. So when we know we're mentally healthy, these are the things the World Health Organization says are happening in our lives. It says that we are in a state of well-being in which we can realize our own abilities. We can cope with the normal stressors in life, right? Normal stressors, remember, life happens. We can work productively and fruitfully, and we're also able to make a contribution to our community. That's what the World Health Organization, that's how the World Health Organization defines mental health, right? And so the American Psychiatric Association tells us that a mental illness or mental illnesses are health conditions involving changes in our emotions, our thinking, or our behavior. And it can also be a combination of those things. Oftentimes, it is a combination of those things, right? And that mental illnesses can be associated with distress, distress, and or problems functioning in our social lives, our work lives, or our family lives, right? So when we know that we are experiencing, and we also know when we know that we're experiencing some sort of distress, often we aren't aware of it. Most of the people that I get to see come to see me not because they got up one day and decided that they needed to see a therapist, but because somebody strongly recommended that they do it, or it was mandated, right? And so but what I hope that I'm starting to make clear here is that this idea of faith and mental health can and do coexist. We can and we have to be really both mentally healthy and faithful in our lives. So a couple more important ideas I wanted to kind of drop right here are things like biology is equally as important as environment. Place and the things that we experience every day are very important to the way that we function and how successful we are mentally. Dr. Bruce Perry has said that we really believe, really do think that we think about physical health a lot, but what he's explained is that we can be born with a propensity for a particular thing to happen for us, but then environment will cause that thing to activate, to come on, to turn on. So it's really important, y'all, that we remember that just because we might have the biology for something doesn't mean necessarily that we have to experience it. We can do a lot of things. We can do things to maintain our physical health, but anyway. But also some of those environmental issues that impact our mental health, or that can activate some things for us internally in our heads and in our bodies, are events that we refer to as traumatic, right? Things that are like a punch in the gut, stuff that happens to you that's totally unexpected, that creates a lot of distress in your life. And so those kinds of things, and sometimes they're defined as adverse childhood experiences, but we can also have adverse experiences as adults in many different kinds of environments, in many different kinds of ways, right? And so those things can impact our mental health. They definitely can impact what happens inside of our brains. And yeah, so now I'm just gonna tell you a little bit about a way of functioning or working with and supporting our mental health that I've encountered, and it is choice theory and choice theory was developed by Dr. William Glasser. He actually started out by calling it reality therapy. He wrote the first book on reality therapy in 1965, but he began practicing after he completed his education in the 50s. And Dr. Glasser worked in psychiatric centers, juvenile justice centers, schools. He worked with a lot of different populations. And he realized early in his career that there was something that we weren't doing that was really helping the people that we were trying to help. And so he developed reality therapy. Over the years, this theory evolved, and ultimately in 1998, he published a book on choice theory, A New Psychology of Personal Freedom, which every time I think about that title, I get really excited. But then I practice, right? I practice using choice theory with everybody that I work with and in my own life every day. And so when that personal freedom piece for me is improving our sense of agency and understanding that we have the capacity to do more with our mental health than we've ever been told that we could do to support our mental health. We have way more ability to impact our mental health than we've ever been taught to believe. Glasser said that we have 5 basic needs that drive all of our behavior, and that's the need for survival, power, freedom, love and belonging, and fun. Right? Everything we do is designed to get one or more of those needs identified by Glasser and choice theory. Everything that we do is designed to get one or more of those needs met. He also talked about, he outlined 10 principles or 10 axioms that are critical in the way that we think about how it is that we can not just practice this theory, but also how we function in our everyday lives. And they include things like, and we're not gonna go over all 10 of them, but they are things like, the only person's behavior I can control is my own. All behavior is designed to get one or more of our 5 basic needs that he identifies 4 of them as psychological, and one of them is physiological. Right, survival is a physiological need. But everything we do is designed to get one or more of those needs met. All we can do every day is behave, and all of this behavior is designed to get one or more of those needs met. But it's also total. The behavior is total. And it's made up of 4 parts: acting, thinking, feeling, and physiology. Acting is what we can see, right? The thinking happens inside of our heads. The feelings are the equivalent of the emotions that we experience on a daily basis. Actually, we experience a lot of emotions in a day. And the physiology is the stuff that happens inside of our bodies. Now, we have direct control over our acting, our thinking, right? So if we change our acting, we can change the way that we think and the way that we feel, right? We have indirect control over the feeling and physiology. So if we change those two front wheels of the car, the acting and the thinking, then we can definitely change our feelings and our physiology, right? So all of our behavior is purposeful. As I stated before, it is designed to get one or more of those 5 basic needs met. It is designed to get one or more of those needs met. And when we identify what need we're trying to meet with what behavior, it makes it so much easier for us to determine if that behavior is helpful in getting us closer to that need, or to meeting that need, or it's less helpful, right? And so Glasser also identify lots of behaviors that we can do as individuals to get closer to the people that we want to be close to. He said that all long-lasting psychological problems are relationship problems. And if they're relationship problems, usually that relationship is a relationship that's a part of your present life, right? And somebody that you really want to be close to, but something has gone wrong in the way that you are having relationship with that person. So Glasser says that leads to a lot of psychological problems. And if you look around, we really want to be connected to people. There's a lot of stuff that's going on in relationships today. So Glasser identified that all long-lasting psychological problems are relationship problems. We've got a lot of relationship problems happening in our society, right? And but not only did he state that, but he also helped us to identify some behaviors that we could use to connect with the people that we want to be connected with. We call those connecting habits, right? No brainers. They are connecting habits, and what they include are things like accepting. So we try to accept people the way they present themselves to us. Sometimes we have to do some digging, and we have to make sure that we know who we are, who we're working with, right? But we accept people the way they present themselves to us. We learn to negotiate differences. Sometimes we come to the table and all we want to do is win, right? I know what's best for you, just like I know what's best for me. But don't forget that axiom that says that the only person's behavior I can control is my own. So we get to a place where we know we can't do that. We don't. So when we sit with someone, and we're going to talk about this a little more later, but we learn to negotiate differences. And then we have to improve our ability to trust not only ourselves, but the people that are dear to us. We learn to trust. And then we learn to listen. Listening is such a powerful skill, but, just like breathing, sometimes we do it just enough to exist, but we don't always do it really well. And so when we talk about listening, we are talking and thinking about really actively participating in being focused on the person that you're speaking with or listening to, watching the way their body language, their whole lot of active listening skills that we could learn, and we should learn, and we should practice every day. Paying attention, leaning in, listening, not just hearing the words that a person's saying. We're not listening to come back, right, to argue with someone. We are listening really to kind of hear what it is that they have to say. Encouraging. We encourage the people that we are around. We try to support. We encourage them to get go reach the goals that they say they want to reach, that are not causing them harm or anyone else around them. We are respecting of the people in our lives, and respect is a very, seems to be something that's really, really important. But oftentimes, people want to get respect and they don't recognize that it's reciprocal, and so we got to give respect as we are expecting to receive respect, and then supporting. Right. So all of us are doing all of these things when we're learning this theory. And that's another thing I really like about choice theory is Glasser taught that we would teach people the theory, right, while we are helping them to overcome whatever the situation is that they are working to overcome. So I love being able to tell people that these are the ways that we work towards having better relationships with people. And when we have better relationships with people, we also reduce the likelihood that that we're going to have psychological. I want to wrap this up. I want to wrap this up by giving you a little more information about how you can support your mental health by supporting the relationships and the way that you have relationships in your everyday life. So we're all connected. We all need each other. We all need each other, y'all. There is no such real thing as independence. We are interdependent. And remember I said earlier that Glasser told us that all long-lasting psychological problems are relationship problems, and those relationships are likely in our current lives, right? So when we are supporting our mental health, we are supporting the people around us, because that kind of helps us to be more mentally healthy. And one way to do that is to use this idea that Glasser taught. Is called the solving circle. And in the solving circle, what we do is we decide that, there are all these little steps, but we decide that we don't have to win all the time, right? We decide that we're going to invite another person to enter the circle with us, right? Unless if this is a really good technique for avoiding conflict, but also just kind of managing the things that happen in your life. Because remember, life happens all the time, and the weebles wobble, but they don't fall down. So if stuff happens, this is a technique we can use to maintain our balance and our good relationships. So you invite another person or persons into the solving circle. You agree that your relationship with that person is more important than winning, right? So sometimes what gets in our way is we go and we want to have a conversation with somebody. We're not practicing our active listening skills, and we already decided that we know what's best for everybody. So we got our strategy, and we decided that we're going to win, and we can't hear. There's no way to negotiate differences when we step into the circle, and the relationship is not more important than winning. When the relationship is more important than winning, then we're going to negotiate differences, right? We're going to look for a way to compromise. All right, so the relationship is more important than winning. We are going to not hit below the belt. Not going to hit before, because when we're close to people, man, we know all of their weak spots, right? But we're not going to be pulling them. We're not going to be hitting them. We're not going to be touching on all of those weak spots that we know our people have, right? So not hitting below the belt. We are not going to pull up stuff from the past, right? We're not going to sit in here and say, because I feel like I'm losing ground, I'm going to pull up something you did 20 years ago and throw it into the conversation. Nope, we're not going to do that. We're going to stay focused on the present and the present problem. One thing, you're going to talk about one thing in this solving circle, the one thing that is really pressing that you have agreed to come into this circle to talk about. That's the only thing you're going to talk about in the circle. And you're going to talk, and you're going to listen, and you're going to summarize, and you're going to listen, And if you can't come up with a solution in that moment, then what you're going to do is agree to step out of the circle. Step out of the circle. Take some deep breaths. Maybe you need to walk around outside. Maybe you need to get some Zen tea, some calming tea, or do some breathing techniques. Whatever it is that you need to do, you do those things, and then with the intention of stepping back into the circle. So you come back into the circle, and all those other guidelines still apply. This person is more important than winning. I'm going to practice those active listening skills. I'm not going to hit below the belt. I'm going to negotiate till we come up with a solution, and then you will, right? If you've decided that's what you're going to do, and if the other person is valuable to you, and they've decided as well that we're not going to be yelling and screaming at each other, we are going to come up with a way to solve this situation that doesn't hurt either of us, and it gets us closer to our goals. I really, 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 really like the solving circle, y'all, and I teach it to a lot of the people that I work with, especially individuals who have relationship problems or who have committed family violence offenses. It really helps our mental health. And then we're going to always use those connecting habits, right? So most of us criticize people. We criticize life. We complain. We do this. We do that. But the connecting habits tell us to remember to accept people the way they are, to remember to negotiate differences, to trust. I mean, trust is a big deal, just like respect. Trusting a person is sometimes it's very hard to come to that place of trusting someone. But we can do that, right? I was talking to someone last night about bringing all of our stuff, our relationship stuff, all of our histories into a present moment or a present relationship. We have to be mindful of that. So the other thing we need to do is self-evaluate. We got to be thinking and reflecting on our beliefs and our interactions and seeing what are we bringing into this relationship that is toxic, right? That doesn't need to be a part of the relationship. We also have to think about taking care of ourselves, our mental health, right? It's kind of hard for me to stay balanced and thoughtful and reflective when I am experiencing extreme distress because of the things that have happened in my life. So it's important for us to take care of our mental health. And I know many of you, every time I get on a plane and they do the safety talk before the plane takes off, they tell you if something should happen to the air pressure and the mask drops down, if you're traveling with someone, a child or someone else who's vulnerable, put your mask on first. It is really important, y'all, that we learn to take care of ourselves, so that we can take care of others. We talk about self-care a lot. It's like a big old buzz thing now. But one of the things that's important about taking care of yourself is knowing that you do not have to spend money, a lot of money. And there's no specific way that you can take care of yourself. You know what you need. You know what you like. You create a self-care routine that fits your life, right, and your budget. It doesn't have to cost you money. It does not. And lastly, I want to end up with Taranga. And so Taranga is a concept that I learned in West Africa. And I was always amazed when I would travel to Senegal, and it's a country on the west coast of Africa. And I would see people, always looking out for each other. Babies would be tied on somebody's back, and they wouldn't necessarily belong to that person, but that person was taking care of them. And it just seemed like everybody was so concerned with everyone else. And I asked my then spouse about it, and he told me that it's called Taranga, and Taranga means hospitality. But not hospitality the way we are familiar with hospitality, not the way I grew up learning about hospitality. And it's a kind of what they would do is when they got up preparing meals for the day, they didn't just prepare enough food for the people who were in the house. They prepared enough food just in case someone stopped by, a stranger who happened to be hungry, so that they could take care of them. There would be something for them to eat. They prepared a place for people to rest, if just in case somebody stopped by and needed a place to rest. And what I am doing, for in my clinical practice, is I am developing a way of doing therapy with people, particularly people who are part of the marginalized communities. That is not so heavily based on what we have become familiar with as a part of the medical model. And so we are creating an environment where everyone feels welcomed, where there's no stigma associated with the mental health services that we offer. It is so inclusive. We practice using cultural humility and just welcoming people and helping them to feel like this is where we want you to be here, and we want you to feel safe when you come to see us. And the history, one of some of the reasons that I started thinking about these ideas was, one, my being in the West African communities, but also I have been doing a lot of research around the things that have happened to African Americans and people who happen to be a part of BIPOC communities and marginalized communities in this country, and how too often we were experimented on, right? Our ancestors were experimented on and treated very badly as people were developing treatments, and how often those things were done to us as opposed to with us. And what we're doing is working with people to help them to develop plans to change the way that the direction of their lives. And so we invite everybody to learn more about us and the things that we are trying to do. We are big advocates of prevention, meaning that we teach people that it is possible to be more mentally healthy, to know what mental health is, so that and what it looks like, so that you can do things to be more mentally healthy. We help you to get information about being a more mentally healthy parent, so that you can help your children to be more socially and emotionally developed. And but anyway, I am running out of time, but I want to begin to share these ideas with everybody, and I hope that you have gotten something from this conversation. And I look forward to hearing from some of you at some point. If you look for us, we're on social media, and it's the Southern Center for Choice Theory, Facebook, Instagram, all those places. And our website is scctgeorgia.com, and our office number is 478-741-1268. Thank you again for joining us, and enjoy the rest of your day.